What's up, guys? John here. Titan Talk Tuesday. We're in the house. It's official. Thank goodness we're here for another Tuesday. I love it. You know, the week's just starting. We're getting it off. Monday, we're already through that day. We're rocking. We're rolling. Ready to get the hump day almost, right? I mean, I don't know where you're at. It's 6:05, 6:03 my time here. Eastern Standard Time. So you guys on the West Coast, it might be 3 o'clock your time. Anyway, we all know what's going down. We're going to go over all types of different things today. Titan Ultra Blend, therapy of the week. What's in Titan Ultra Blend? How's it going to help you? What's it really going to do? I mean, I'm going to break it down for layman terms. I'll tell you what it is and where it comes from. All right, we're going to talk about HCG in regards to testosterone replacement therapy. What's up, guys? Going to have a great Tuesday. Going to cover all types of things like we were talking about. Entrepreneur life. What's it like to be an entrepreneur? I get the question a lot, or I get it thrown around a lot. I'm an entrepreneur. I'm a CEO. I'm a boss. Well, I want to know what your CEO, what your boss of. Are you an entrepreneur, and how are you going about doing that? Also, want to know about Labor Day. Labor Day. What are your plans for Labor Day? What do you guys do for Labor Day? I'll tell you guys what I do for Labor Day, and we'll throw a Labor Day special out there. Friday, before Labor Day, I guess the pre-Labor Day special. You guys will have to wait till Friday when we go on live, and we will announce that special then. I want you guys to tune in so you guys can take advantage of it. If not, you guys can see the playback. If you're patient, you can possibly text us, all right? I want to tell you what we do. Since everybody's on there, can you talk about running HCG tests? Yes, I will talk about running HCG, testosterone, and aromatase inhibitor, and anastrozole. So stay tuned to that, Red Pill. I will talk about that. But let's talk about what Titan Medical Center does, because I get that question the most out of everything that we do. So Titan Medical Center does hormone replacement therapy for males and females. We do medical weight loss, vitamin amino acid injectable therapies. We do rejuvenation detox like glutathione, which is a super antioxidant. We do hair health capsules. We've got hair foam for guys if they're trying to keep their hair, make it thicken a little bit. We want to help you guys out too. We have skincare products that are prescribed that come from the pharmacy. They have very concentrated doses of some of these things that these women want, especially our fat loss cream. That one is a big, big seller with our females. It helps for aesthetic reasons, tighten the areas, shrink fat cells in those areas, so to make a nice aesthetic look. What's up, guys? Oh, man, look, Jay's in the house. What up? Pat, how you doing, man? Yes, we actually know what we're doing here. Thank goodness. We have real medical providers, real doctors, real medical staff that you guys see as our patients, and that give you the recommendations. And the pharmacies, the U.S. licensed pharmacies, fulfill these medications for you guys. So you guys know what you guys are getting every time. What time do you do your podcast on Friday so I know? We usually do about 1:30. Me and Drew usually go on. We're trying to lock down a solid time. So we've been playing with those times. If you guys don't know about it, Friday, Big Drew's taking over the Titan Lifestyle podcast. But I'm joining him on some of those Fridays just so we can just chime in, go back and forth about some of the things that aren't Titan. So we talk about AirPods versus Super Dre Beats. He's a super believer in Super Dre Beats. He loves those things to death. I like them too, but I do like the AirPods. So we went back and forth on that and a lot of different things. Titan strong, baby, all day. How you doing, Chad? How you doing? So we'll go over our poll question. I always cover one chapter of the Ultimate Health Bible for you guys. Your guide to disease prevention, anti-aging, and fat loss. There's a lot of great tips in there. It was written by me and my man, Jeff Bahar, so it's a great book. I actually shot some of the commercials for it today. I can't wait for that to air. We have some exciting news about where we're moving. Hi, Tina. How you doing? So we're moving on up like George and Wheezy. We're actually getting a bigger and better location that's going to be ours officially. We own it type deal, not leasing or renting. I love that, right? You got to believe in it because you're investing in yourself and it's yours at the end of the day. All right, quick question, but can Imperelin and CJC cause gyno? So usually not on the gyno tip. Usually for those things, it doesn't usually raise prolactin levels and estrogen levels, but everybody's different and people are estrogen sensitive and different things can be going on. So you should blood test, see what's going on with prolactin and estrogen levels, specifically. All right, Q&A. I'll do the Q&A at the end, so everybody hold their questions. Let's really get into it. I'll do a giveaway too as well And remember, the Labor Day special will be announced Friday, so I want you guys to tune in for that. So let's get into it. Therapy of the week, Titan Ultra Blend. Why is Titan Ultra Blend so awesome? Why do I call it the limitless drug for us, right? And it's not a drug per se, but it's an injectable therapy that's doctor prescribed. And what does it have in it? So it has NADH, it has carnosine, it has taurine, and it has B12. And so I'm like, all right, what are these things, John? NADH sounds really, really cool, but what is it and what does it do? So NADH is a coenzyme. It's in every living cell of your body automatically, right? And what it does is it helps energy, alertness, cognitive enhancement, so really being able to focus in. And a lot of people take some drugs that hurt them in different ways. So Adderall is one. Now Adderall is used by people that have ADD or ADHD, right? And it was made for kids and adults alike. So these people take this medication if they really need it, and it helps them focus in, and it doesn't help them stray. We were in here today with Andreas Yepes, and he kind of reminded me of somebody that needed a possible medication, right? Because we were talking about one thing, and then he just jumped to another, and he jumped to another, and he wanted to do this and that. So he was just really excited. I think that's what it was. But if you really need this medication, it will help. Some people don't want to take this medication. And why don't they want to take this medication? Because it's a controlled substance, one. Two, it's like a stimulant, right? It's like a methamphetamine type deal almost for some people. And it doesn't really help them. So they don't want to take this medication. They want to look for substitutes. And they want things to help them get better clarity and mental focus, without having to take these medications, even if they're not prescribed these medications. So what can this help? This can help you. NADH can help with that. Now, there are some things that add back that will help you in the therapy. So the taurine that's in there is essential for brain function. It's an antioxidant as well. We've got B12, which is great for energy, boosting metabolism, great for brain function. What else do we have in there? We have, I already said the NADH. We have B12. The other one is carnosine. Carnosine is in every muscle in our body, including our brain, our heart. It's more concentrated in those muscles when you're actually working them out. So it's awesome. So this can be taken any day, and usually be taken in the morning. It will help you throughout the day as far as energy, being able to focus in on what you're doing. A lot of people take it, including myself, and this will definitely help. And it will help on the cellular level. So it's really cool. Look into Titan Ultra Blend, right? You guys are going to love this. NADH, carnosine, B12, taurine. This is an awesome blend for you guys. I promise you. Look up the benefits of NAD plus is what they call it online. That's really NADH. So look it up. Get educated. Find out how you can help yourself. Be preventative. Feel better, look better, perform better. That's what Titan does, right? That's what I want you guys to do. If you guys aren't using this, look into some of these things that I'm telling you. Use this education and help yourself, right? All right, so let's talk about HCG. I love ECAs too. ECAs are best. Glutamine's a good one too. No, glutamine is in a couple different other blends, so that's what it is. Dang. So this guy said he sees some major changes in Drew. Wow, okay. All right, so that's awesome. We will talk about that in a little bit. So let's talk about HCG and testosterone replacement. So when you're going on hormone replacement therapy or testosterone replacement therapy, some doctors use HCG and some don't. Now, I don't know why some don't. They might not be educated. They might not believe in using it along with that. I understand both parts. That's fine. Here at Titan Medical Center, our physicians and medical providers use HCG along with testosterone replacement therapy. And they use this because when you take testosterone in, whether it's oral, whether it's an injectable, whether it's a cream, you're putting exogenous testosterone in the body. Your brain recognizes this exogenous testosterone in the body. It's not dumb. It's on top of it. It's the best machine ever created. So when it focuses in and it realizes that, listen, we have this exogenous testosterone. The signal from your brain to your testicles, right? The brain tells the testicles, hey, listen, we've got this in our body. We don't need you to work because that's where your testosterone is getting made down there. It's getting produced. And it's getting shoveled through the body at that point. So when it shuts down, your natural production is getting shut down. Now you're replacing the testosterone that's getting shut down with the exogenous testosterone you're putting in your body. So if you're getting a high level when you're doing a lab test of total testosterone or free testosterone, naturally, without replacing it, you don't want to mess with those levels. Guys, I don't care how big and fast you want to get. It's not going to make you Arnold Schwarzenegger overnight. You're going to have to do this for a long period of time. You're going to have to eat. You're going to have to have genetics. You're going to have to train. You're going to have to do the right things. And I'm telling you guys, I've seen numbers come back at 10,000 and above. And the guy was like 190 pounds. It didn't matter his level of testosterone. He wasn't getting bigger faster. I promise you that. So it's not always about the amount that you're doing, okay? So on the exogenous tip, when it shuts down that signal to the testicles get shut down. What happens to the testicles is they shrink. They go into atrophy. This does not feel good. I know from experience. I know a lot of other patients do too. You don't want to have shriveled prunes down there. Aesthetically, you don't want it. Physically, you don't want it. I promise you. A lot of guys tell us when they call in, some anyway, I don't care about fertility because I know HCG is for fertility. Well, it's not just for fertility. It's to make sure that your semen production stays up to par too as well. You don't want your semen production getting shut down all the way or going and getting suppressed. You don't want that. So you want a full effect. You want a nice aesthetic look. I promise you your partner will probably like that too as well. So trust me, HCG is the way to do it. Now, what does HCG do when you're on testosterone replacement therapy? Because we know that putting the exogenous testosterone in the body is what we need to do to replace the levels if it's low. So if it's low and deficient, we're putting testosterone in. That's raising the level of testosterone, right? We're there. We got that good. Now, the signal gets shut off to the testicles. What do we do at that point? That's when the HCG gets introduced. That introduction of the HCG will mimic the signal of the luteinizing hormone down to the testicles to make sure that they start saying, hey, listen, we still need you to produce, and it produces. Your natural production never gets shut down at that point. Your semen production is still up to par. So when you're getting this all done, you're getting a great effect. Mood enhancement, it's going to get physical enhancement. You should get some better benefits on HRT with HCG. And like I said, you won't get no shrinking in the testicles. You won't get no tightness. It won't be uncomfortable because I'm telling you, it can get uncomfortable. So at that point, don't have them shrink all the way. So I hope that covers some of your questions. We don't do HGH, but we do some GHRHs and GHRPs. Yes, all right, yes. We love to be re-energized too. That's what it's all about. So HCG is essential when you're doing hormone replacement therapy as far as getting all the benefits without any of the negative side effects or minimal amount of side effects. That's what you want. You want all the benefits without any of the downfall, right? That's what you want. So that's what I want anyway. You want everything optimal. HCG does wonders for sex drive too. So libido, so your partner will actually benefit from you. They're actually, I tell males this all the time. I say, hey, listen, your wife or girlfriend or partner is either going to love us or hate us when you start, because you are going to get revved up and you're going to be like a bull, and they're going to be able to keep up with you or not. And if not, they're going to be like, what are you doing? And then they're going to want to get up to your par and get right there because they want that sex drive too. Trust me. I say it all the time. Everybody likes sex, whether you're heterosexual, bisexual, asexual, whatever it may be. You're going to like sex or pleasure in one way or another. So you definitely want to please your partner, yourself in all ways, shapes, or forms, and this will definitely help, all right? So, all right, Nicole is definitely going to email you back. I'll make sure she gets this. All right, so orals for HCG, there's troches or sublingual that you can use. We use those for patients that are traveling that can't carry the injectable on them or don't want to. So that can be effective. You might have to dose it higher, just depending on who your provider is and what they say. You always want to follow their medical advice or our medical advice from the medical provider. Yes, we can't wait to have you part of the Titan family. Nuclear warhead, that's awesome. All right, so we talked about HCG, talked about testosterone replacement therapy and why they need to coexist together, right? Because they work together. An aromatase inhibitor, I'll mention that on the next one. So why would we use anastrozole with hormone replacement therapy? And there's this big debate. There's this guy out there, I'm not going to mention his name, but he's going on and on about people shouldn't use aromatase inhibitors and why they shouldn't use aromatase inhibitors. It's totally off, right? So we'll discuss that next Titan Tuesday. I promise you. I want to get into it, but I will tease you with it. Labor Day specials. So Labor Day, I'm going to do something for you guys on blood work maybe, or therapies maybe. I don't know yet. I'm going to decide here in the next day or so, and that's why I'm going to go live and tell you. So if you guys want to get a discount on blood work or possible therapies, I would watch Friday. I just want to throw that out there. I'm going to do some specials on Friday. Also, our giveaways, Make sure you guys are tuned in for the giveaways. The giveaways are going to be on point. We're going to do Titan gear giveaways, and we're going to do free blood work giveaways in the next 2 weeks. So, the little amount of, we love having you part of the Titan family. Thank you guys. I appreciate it. All right, so Ultimate Health Bible. Let's cover some different things, the Ultimate Health Bible. So I covered the commercial today and what it does. So when I talk about the Ultimate Health Bible, and Jeff does, it's part of the nutrition portion. So if you want to learn how to eat correctly, you want to really read in some of the chapters in there that talk about nutrition. He breaks down everything from what food you should eat, I think where you should shop at, and we can actually give you an online directory of some of these prices so you guys can price shop some of your foods and put them together before you can get there, or even order them. Like I use an ordering service for food, and you can pretty much put all your food together and have it delivered to you. So it's kind of like those, I see those things, online programs or subscription programs where they send you the food and they send you the recipe. We can pretty much give you the free recipes. Also, the app is coming out. I myself am at fault that it's not already out because I have to shoot the videos, the workout videos for you guys. I'm trying to do it, okay? But everything else is done. So we will have the diet plans for you guys and the training exercise for you guys. All right, let's answer some questions here too. All right, so Anavar, safe or better alternative? So oxandrolone is Anavar, right? Oxandrolone is the chemical, and that's what it is. Anavar is the manufacturer trademark name. So Anavar is good for some things that it's approved for. Now, what is it approved for? It's approved for people that are burn victims to heal faster because they're laying in the bed and they don't want their muscles to go into atrophy, and that's what oxandrolone is good for. So that's why a lot of bodybuilders, a lot of these people use it for aesthetic looks. It hardens muscles, it makes the muscles stay, and it doesn't go into atrophy. So when you're using it, it is an androgen, so it does create an anabolic effect if you use it, and some of these guys are using it at extreme doses. Oxandrolone should be used for certain things. There's some other things you can use it off-label for. If you've had surgeries or serious back issues, shoulder surgeries. I mean, there's a lot of different things that are out there, but it's all case specific. So when you come here, I wouldn't ask for Anavar. I'm just being honest with you. That's like a red flag to a doctor, like Anavar. We don't judge, but we don't condone too. I do want to bring that up to you guys. When you guys are talking to the doctors or medical providers, I wouldn't go into telling them that if you're on hormone replacement therapy with any doctor, that you're taking more stuff on the side, or you're taking tren, or these different things that can raise a red flag with a medical provider. Let me tell you why, and this is getting to the bodybuilding thing with the doctors. If you tell that to a doctor, and a doctor doesn't know that anything about that compound, or that compound could be very unsafe to your health, the doctor is always going to look at the negative effect that it could cause to you, and the benefits, and what the risk versus the reward is. And those compounds to them are just, they're illegal, they're black market, they're underground, they're not safe. That's what their thought is. So when you tell them you're introducing this into your regimen, one, they're going to get scared because of liability. You are a liability at that point. If something happens to you and you go to the ER, they're going to blame the doctor and possible hormone replacement therapy or testosterone or something like that, because that's an anabolic and an androgen too. So when you're saying things like that, I would be very wary of what you're sharing as far as illegal things, as far as underground sources or anything like that. And it does get brought up, I wouldn't say a lot, but it does get brought up here or there. So I want to make sure that it's clear and out there. When you guys are talking to your doctors out there, and I'm not talking about just Titan Medical Center, but when you go to your primary, even if you think that doctor is the coolest doctor ever, I promise you they document all that stuff in your chart. I promise you. And even if they tell you they don't, they're documented just for liability purposes. I mean, I know a lot of doctors, unless they're really corrupt, no way. Anadrol, age wasting, we brought this up too. So anadrol is used for another thing for women that are anemic, actually. And it was brought up because, somebody said, hey, listen, how much anadrol, can anadrol be taken by women without getting negative side effects? And yes, it can be taken. It's at clinical doses without negative side effects. Now, if you start taking it at super physiological doses, you're going to get masculine traits or more hair growth or whatever it may be with these androgens. So at that point, know what you're doing, know what you're taking, and please don't overdo it. All right? If you're taking anything you shouldn't be, and I don't advise that you do, always go with a medical professional, medical provider. All right, guys. I'm going to do the last thing. It's our Titan giveaway. We will do some Titan gear for today. So hashtag Titan gear. Text it to 727-389-3220. Text it to 727-389-3220. Hashtag Titan gear. You guys can get a cool shirt, hat, bag, leggings for your girl or yourself if you're a woman, tank tops, whatever it may be. I got you guys. If you guys have any more questions, DM us. I will bring them up next Titan Talk Tuesday. I know we got Labor Day coming up, so I hope you have a great weekend out there. Be safe with your family, loved ones. Have a great time. Be active if you can. I'm going to try to be as active as possible. I think we have a storm maybe brewing. Hopefully not. Hopefully we get some sun. Hopefully we luck out and we get some beach time or some pool time. I promise you. So enjoy the last weekend of the summer. That's what I call it, right? Labor Day is like the last weekend of the summer. All right, so yeah, enjoy it. Spend time with your loved ones. Have a good Labor Day. I will talk to you guys Friday with Big Drew. We will announce the special Labor Day special. I'm John for Titan. I appreciate you guys. Thank you guys for tuning in. We'll see you guys next Tuesday, Titan Talk Tuesday. Thanks, guys.